Hey there, how are you? Good to see you. Today in this new video, I want to give you a hip remodeling program, which is basically 6 stretching exercises and some movements that's going to help you restructure your hip. Because sometimes, because of our culture and our society today, we can be sitting down a lot, hunching forward, and our hips can get really tight, and a lot of back pain can stem from the tightness in our hips. So it's super important for your hips to be neutral, to be healthy, to be strong, because if that isn't the case, then you can injure yourself, you can have a lot of chronic pain, and no one likes to live with pain because pain sucks. So in this video, I'm going to lay out for you 6 exercises you can do maybe every 3 days if your pain is really that bad, and it can really alleviate a lot of pain. I know it worked for me. I had a lot of back pain previously. My hips were a little bit lopsided because of some exercise, and this literally fixed me up. But I did it for a few weeks at least and maintain a consistent rhythm of doing it every day, or at least every second day. So if you have a lot of pain in your hips, you're a little bit lopsided, then this will literally help you so much. Hey, so this is the first stretch. This is a lying down gluteal stretch. It helps stretch the gluteus maximus. So what you want to do is lie on your back. You're going to put your right ankle on your left knee, lock your hands around your left thigh, pull your knees towards your body with your hands, and as you can see, you hold for about 20 to 25 seconds or even 30 seconds, and you're going to push your right leg into your knee once that 20 to 30 seconds is over. And what this does is it helps stretch the glute, and usually the hips can rotate laterally, which means side to side if the glutes are really tight, and that can pull your femur bone, which is the bone that's connected to your bum and your knee, that long bone there in the thigh. So this helps release the pain and release the tightness in the glutes. So like I just showed you, you want to hold for 20 to 25 seconds or even 30 seconds. Once that is done, you push your right knee forward and your foot into your left knee for about 3 seconds, and that will activate the muscles in a stretch position, which helps recalibrate or retrain that area to maximum function. So in a second here, I'll push my right knee into my leg, relax, as you can see, and again. So you want to do that 3 times, making sure you are breathing, you're controlling your breath, and you want to feel the stretch on that glute on the right side, because you have to really feel it. Then after that is done, you repeat on your left side, and then we'll be moving into the next stretch right after this. So now we go into the second stretch, which is a hip flexor stretch. So this helps release the psoas major, which is also known as the hip flexor, on the front of the leg, as you can see where I'm pointing. This is a great exercise or a great stretch, as you will feel this straight away. And if you have a tight hip, sometimes that muscle there, the hip flexor, can actually shorten. So you get a shortened hip flexor, which pulls your hip forward, and then your lower back becomes lengthened. And that's why sometimes you look back and have some pain, because you've got a weak glute, you got a shortened hip flexor, and now your lower back is elongated, and you got a classic pelvic tilt. And that is very common with the majority of human beings, because when we sit down a lot, we naturally have our tips rotated forwards because we're sitting down, we're hunched over. So this exercise here, this stretch, literally alleviates that. So it's a great follow-up stretch to the gluteal stretch. So as you can see, I swapped legs now. So we just want to make sure our knee and ankle are at 90 degrees with each other, and the thigh. So hold that for 20 to 25 seconds and then go into the next one. This is the next exercise. And this exercise is very good for getting blood flow into the low back region, especially if you had an injury and you felt pain before. This is a light, easy exercise to get blood in the area. But you basically just want to do as visually represented here. Stand up straight, bend backwards on an object hip height, being slow and steady, and then repeat about 10 to 15 times. You'll notice after you've realigned your hips, doing this exercise will feel much better. Everything will feel straight, and there'll be less pain overall, and it'll feel quite good. So the next exercise after this one is just the same thing, a back extension, except on the floor. So the gravity properties is a bit different. So when you're standing, gravity's pulling you down while you're bending over in space, but this is on the ground. Gravity's pulling your hips downwards. It's a different position. So same thing, pushing nice and gently, making sure you don't feel too much pain, getting that blood flow in that area and strengthening that area. Do it about 10 to 15 times, and that's pretty much that exercise. And then we go into the final 3 exercises, which are very quick, and it's just to re-establish the movement patterns of the hip. So grabbing the knee, pulling it towards your body, gently rocking it, nothing too hard. You're just basically testing the movements of the hips, because obviously if your hip's very tight, then you'll find the trouble of rotation of the hip, and then that means you got to stretch more and do a little bit more work. So yeah, I'm going to do it on both sides. See that my left leg is a little bit more flexible and mobile than my right leg, and I've had that issue for a long time. So just be aware for yourself as well. If that's you, then you sort of stretch more and do more mobilization work on that affected side. So always be aware of that. You don't want to train with lack of mobility. It can cause problems, and trust me, it doesn't feel good. So after that, both legs rocking 10 to 15 times, just getting that movement in there, pulling towards the chest, really working on that. And that's pretty much it. 6 exercises, 6 movements, re-establishing the function of the hips, making sure your back isn't hurting. So this is the final one, just rocking motion side to side. You will feel cracks and you will hear pops in this exercise as the hips move together and rotate. If there is a little bit of a little space between the joints, you will feel the rubbing together and the cracking, popping sound. So it's normal. If it causes no pain, it's fine. If it causes pain, it can be an issue. But don't be alarmed if that happens to you. So 10 to 15 times rocking side to side, and that sets you up. So that's pretty much it. Not too long, all good. So that's it. 6 exercises, 6 movements. This will literally help you so much. It will literally realign your hips, realign your spine together, and it can reduce a lot of pain. I remember when I went through some injuries, I went to the chiropractor, he gave me this program. It literally helped me so much. So, however, you gotta make sure you do this as frequently as possible. Once a day. It literally takes about 5 minutes. The more you do it, the better it is, because your body and the musculoskeletal system, the muscular system, readjusts to patterns over a long period of time, maybe 6 weeks. So if you do 5 minutes a day consistently and you're persistent with it, you notice your body will change its position and you will feel less pain. So I encourage you, you can do it, just 5 to 10 minutes, do the program. I'm going to add a document to this video so you can check it out. If you like to buy that, it's just $5. So buy that for nice ease. If you like to have a document, you can just copy the video if you want to, but that will be there. And yeah, just do it every day. The pain will go away. Be consistent, and just be aware as well, like make sure your glutes, you're aware of the tightness and the difference, because a lot of the pain can come from tight glutes. Sometimes your left side can be longer or not as tight as your right side. So just be aware of that. Be mindful of the tightness in the different muscle groups, because you want to have an equality in the length of your muscle. You don't have one really strong, one really weak, because that's how your hips get out of alignment, when the muscles pull on each other. Okay, so keep it up. You're doing great, and I believe you can feel better soon. So enjoy.